Hi, this is Dr. Corey Maas on Looking Your Best. Today I wanted to address a couple questions that come up with revision patients in rhinoplasty. People who have come to me, which are probably about half of my rhinoplasty practice now, are patients who have had previous rhinoplasties and are unhappy with the results for one reason or another. Usually it has to do with the nose not being perfectly straight or some irregularity or deformity. Sometimes it's actually quite severe, the problems that they're presenting with. But in most cases, the idea with revision rhinoplasty is to improve, just like a primary rhinoplasty, the balance and symmetry of the nose. A lot of patients ask, well, in revision rhinoplasty, is it any different in terms of recovery? And when can I expect to see the final result on my nose, or at least get a good idea of what the final result will be? And in general, that final result is achieved really within a year to 18 months. Revisions take longer to get that final result, but within a couple weeks, when we take the cast off and most of the swelling is down, and I say most, I mean 80% or so of the swelling is down, you'll have a good idea of the general shape and form of your nose. Now, it doesn't mean it's the final result, because in the ensuing month or two after surgery, there'll be days where the tip is a little more swollen, or some area of the bridge or the dorsum of the nose a little more swollen. But in general, within a couple weeks, you can see the general form and shape of your nose, and then the final results we see at a year to 18 months after the surgery. So the summary of this, if you look at revision rhinoplasty, is specifically, not primary rhinoplasty, which heals a little faster, is that you should be able to see the general shape and form of your nose within a couple weeks after the surgery. Still swollen, but that's general shape and form. And then within a year after your surgery, you're very close, sometimes up to 18 months. But again, that year to 18 months are subtle little irregularities, not dramatic changes. When I say irregularities, still a little bit of tip swelling might be there, or pre-tip swelling. These areas around the tip of the nose are the last to heal. If you have any other questions about revision rhinoplasty, concerns, or even want to talk about revising your nose if you have an unfavorable result, certainly you're welcome to write me at drmaas.com. You can call our office here at 415-567-7000, or visit our website at drmaas.com and submit your pictures if you want. We can talk about them online. This is Dr. Corey Maas on Looking Your Best.